Okay, well, I think we're live. We'll see. All right, so hey guys, I'm just jumping on live here on YouTube on a Saturday afternoon. I'm on call, so may have a few times where I have to mute the thing to answer a phone call. If you are watching, if you can hear me, shoot a note into the chat so I can know that this is working good. Just gonna kind of work on the picture here for a minute and make sure that this all looks good. So it looks like people are jumping on. We'll probably go ahead and go live on Facebook too. So let's do a 2-for-1. And as you guys are jumping on, just put some questions in the chat. Some new things to talk about. It's actually a good air day today, so we don't have to talk about bad air in Utah, fortunately. The latest thing that I'm going to make a video about has to do with penicillin allergy. So it turns out that a lot of people who think they're allergic to penicillin really, in fact, are not. And there's a new study that just came out that talks about the potential harm of that. So in other words, if you think you're actually allergic to penicillin, but you're not, and then you wind up getting some other antibiotic, whether that's for an infection or for surgical prophylaxis or whatever, it may actually lead to worsening outcomes for the patient. And there's a couple of good examples of how that could affect moms. So one is in pregnancy. So if you get the wrong antibiotics in labor to cover for group B strep, there's a higher chance that the baby's not going to get good coverage and may have a higher risk of infection. And then another one is with surgery. So if you have a hysterectomy, then if you don't get the right type of antibiotics, then it can lead to a higher risk of infection. So if you guys are jumping on the chat, let me know if you can see this. Send a chat comment. I'm trying to see if comments are working. I'm doing the stream on Facebook a little differently today. So if you can hear me and see me, let me know that you're out there and that you're getting good audio and video signals. So far, I haven't seen any questions pop up on anybody's chat here. So looks like some people are watching those. So if you're out there and you can hear me and see me, let me know. In the meantime, while people are jumping on, I will tell you a couple of things about this whole penicillin allergy thing. So it turns out that a lot of people say they have allergies to penicillin when in fact they just don't. And most commonly people say, oh, I had some nausea, or I got dizzy, or something like that. And these are not true allergic reactions. A true allergic reaction is difficulty breathing, your throat swelled, severe hives, rash with itching, those kind of things. Those are potentially legitimate and significant, dangerous reactions. And those are the ones that really matter. The other ones that I mentioned are really not true allergic reactions and don't really require any change in how you manage someone. Interestingly, even people who've had a sort of a verified severe reaction, say years in the past, maybe in childhood, may have actually grown out of that as they've gotten older. And you can be tested, and that's the other message, is that if there is a need for penicillin type antibiotics, then, and there's some questionable history of an allergy and there's time, you can see an allergist and have a simple skin test, and it'll pretty much tell you. So that's just something to keep in mind if that's a question. So I see other folks jumping on. So if you're out there and you can hear me and see me, put a note in the chat. Just say hey or something so I know this thing's working. Because so far I see people are getting on, but I'm not seeing any comments. And since this is an Ask Me Anything type deal, I need to know if you can actually see me and hear me. So let me know if you're out there, because so far I'm not seeing any questions in the chat. I'm just going to jump over on my computer here and see if there's anything popping up. Alrighty. Well, it looks like it's working. I'm not seeing any. I'm not seeing any actual comments though. It's kind of a crummy looking picture on Facebook. Can you guys see this? How's it look on? Looks like it's starting to stabilize. Oh, hey Leah, how's it going? How's the video look? I'm trying a little different method today. Is it clear enough? Does it look kind of grainy? Can you tell? If you're watching it, let me know if you're watching it on your phone or on your computer screen or what. I'm just trying to see how this is working. It's working. Okay, cool. How's the quality, Leah? Can you tell? Is it too grainy or is it okay? Yep, it's good. All right, cool. Thanks. Awesome. And are you watching it good on your phone? Awesome. I think most people watch these on their phone, so I think for the most part you probably don't need super high quality video to get by. So I'm trying it on my iPad to stream for Facebook, and I've got it on my camera on YouTube. This one's a little bit higher quality video, so I'm trying to stream on YouTube today in 4K, or sorry, in 1080. So hopefully it's a clearer picture on YouTube and still good on Facebook. So looks like folks are jumped on YouTube as well. So if you guys on YouTube can see me, can you put a question or something, anything, a heart, a thumbs up, anything on the chat so I'll know that it's actually working on YouTube. Leah says it's working on Facebook. Thanks, Leah. Okay, Danielle says 34 weeks, fourth pregnancy. Let's see, 8 weeks apart, delivery. Hey, Daly, how's it going? Let's see. Trying to get the rest of this comment to come up. Huh. See more. I'm trying to push see more and nothing happens. How trustworthy is birth control or nursing for birth control? Sorry, Danielle, I'm trying to get to your thing. Let me pull it up on a different window because right now I can only see just a little bit of that. So hang tight 1 second. I'm going to pull that up on another window so I can see what's going on here. Click for more. I'm clicking. There we go. Okay. All right, Daniel, I can see your comments now. Let's see. 34 weeks. Fourth baby. 8 weeks apart. Delivery, conception. Short. Back pain. Normal. Pictures very clear. Because here. Thank you. Yeah. So back pain in pregnancy in general is just common. So that in of itself is nothing unusual and probably really has nothing to do with the short interval between the last delivery and your current pregnancy. It's probably just to do with being pregnant a few times. So nothing to worry about. Back pain in pregnancy is really common. If you just Google it, you can find some good stretches online. A lot of kind of core strengthening things tend to help as well. So maybe check that out. And then if you're doing those kind of stretches and things aren't getting better, then maybe considering physical therapy is not a bad idea. So I do refer patients for that sometimes as well. So just keep that in mind. Let's see. Leah was asking about, let's see, what was it? How trustworthy is nursing as birth control? And so what I tell people on that one is, if you're nursing exclusively, so no supplementation, just breast milk's how you feed your baby. It doesn't really matter if it's pumping or just straight from the breast. But either way, all the nutrition is coming from the breast, and you're not having your period, then it's basically about as good as using condoms. So probably in the 90-95% neighborhood. But the minute you start to have your period, all bets are off. Or the minute that you start to supplement with formula, all bets are off. I wouldn't count on it at all. So just keep that in mind. I've seen a lot of pregnancies that are like weaning babies. So as soon as you start to wean, boom, got pregnant. So keep that in mind. All right. Let's see. We got some other questions popping up here. 32 weeks pregnant, some sharp pain in your right lower sides at round ligament. Short answer, probably. Hey, Didi. Didi's jumping on YouTube. Let me know, Didi, if you can hear me and see me okay. I'm trying a little bit different stream setup. So let me know how it looks and how it sounds if you don't mind, please. Let's see. Ember saying 32 weeks pregnant, some sharp pain, aching in the right lower side. Is it just round ligament pain? Probably. So the general approach that I tell for people who are pregnant having abdominal pain goes like this. Number one, does it sound like labor? So if it's coming and going every 5 minutes for an hour, if the pain you're feeling is coming and going, if it lasts about a minute, if it lasts about a minute and it's coming and going every 5 minutes for an hour, then it starts to sound like labor. Okay, so in that case, go to labor and delivery. But if it's not that, then we're good there. And the next one is if you have any fever or bleeding with the pain. Either one of those, just go to the hospital and get checked out, because there's all kinds of things it could be, and the list is too long to bore you with now. But fever or bleeding with abdominal pain in pregnancy is definitely a red flag, and it's definitely one of those go to the hospital kind of deals. And then the other one is if you have any other symptoms that sound kind of suspicious for something else, like say, for example, right upper quadrant pain could be a gallbladder, right lower quadrant, especially if you have fever, that could be appendicitis. So if that's one of those, getting worse kind of deals, I'd go to the hospital and get checked out. So if it's none of those things, the baby's moving good, the most likely answer is you're just pregnant, and it probably is one of these, round ligament kind of pain deals, some pelvic floor pain, something like that. Hopefully that answers. Thanks, Dee Dee, for the response. You can see me, and it sounds good too. Great, awesome, thank you. All right, cool. So let's see. Jenny said, forgot to ask you on Thursday, something good for insomnia, dying every night. Yeah, so the best thing to start with, if you haven't taken it already, is Unisom. It's perfectly safe. You can take it every night. It's not harmful at all. We use it all the time in pregnancy. I'm trying to see if I can get that light in the back there to not be so annoying. So we use it. It's perfectly safe. And people ask about melatonin. I think melatonin's fine too. But generally speaking, Unisom, it's easy. It actually works. It's safe. You can use it every night with no concern. So think about that one. Okay, let's see. Kate says, hey, wish you were back in Utah. Yeah, I miss you guys. I forget where you are, though. Let me know. Shaylee says, 7 months pregnant, whole body super stiff and itchy, and last month and a half, is that normal pregnancy side effect? 7 months, whole body, super itchy. Yeah. So generalized itching in pregnancy is pretty common. And Dee Dee was mentioning on YouTube, she took melatonin, and melatonin's safe in pregnancy as well. But as far as the itching goes, kind of big picture, the one that, and I always say this, but palms of your hands, soles of your feet, if those are what are itching or burning, that's something super specific that needs to get checked out. That could be cholestasis of pregnancy. It's a big deal. It's one you don't want to miss. So if you're having those things, you need to let us know. There's some blood work we would do that helps us make that diagnosis or not. Now, if those aren't the symptoms and it's just sort of itching, then that's pretty common in pregnancy and probably nothing to worry about. It's an interesting thing. Some of these rashes in pregnancy, why do you get them? It's probably a sort of a modified immune response. When you think about this baby's half not you, why doesn't your body just reject that like it's infection? And the answer is, well, there's some serious changes that occur in your immune system to prevent that from happening. And a lot of these rashes, if you biopsy them and look at them under the microscope with the right kind of testing, you can actually see maternal antibodies in the skin. And so it's almost like your immune system's been turned on itself. Instead of attacking the baby, it's attacking your skin, and you get these weird itchy rashes. So we think that that's probably why. To some extent, some of these antihistamines are helpful in the daytime. Recommend maybe a Claritin or a Zyrtec, and at night maybe like a Benadryl. Get some sleep that way. Let's see. And Jenny said, what else if not Unisom, then maybe consider melatonin, or maybe even try like just half a Unisom. Let's see. Allison, can you get a spray tan when pregnant for a vacation? Yeah, it should be fine. I mean, the thing is, they have to make that stuff out of things that are safe for people to spray on them in the first place. So, no reason to think that if you could spray that on a pregnant person. If you want to be a little extra careful, there's some places that do like an organic-based spray, so maybe that's a little safer. Sounds like a better idea, but I think in general, spray tans are fine. Okay, hey, let's see. Simone, is there some reason that women can lose baby weight easily postpartum and others struggle? Yeah, it just kind of one of those everybody's different type deals. I don't know that there's any, hard and fast rules on that. But it's not always easy. There's so many factors that are involved. It's hard to give anybody one straight, simple answer. Sorry, that's a complicated, not easy to answer question. Let's see. Cheyenne says 14 weeks pregnant, fourth child. Can't recall not being able to eat much without getting sick most of the days or anything to help with this. Yeah. So, Cheyenne, I would recommend go to my YouTube channel, which I'm gonna just type in right here. So Wesley Ski, and there's a whole video on there about management of nausea and vomiting in pregnancy, and so I'd recommend you check that out because it's kind of a lot of things to go through. But the quick version is that if you haven't tried anything yet, I'd recommend starting with some simple things. Vitamin B6 and Unisom, for example, they are both safe. You can get them over the counter, no prescription required. And that's also true with ginger. Some people get some relief with ginger, which you can get at most grocery stores as like a candied sliced ginger root. And you can just kind of use that as needed. But B6 and Unisom is pretty effective for a lot of people. There is a prescription version of that. It's called Diclegis, and the new one's called Bongesta. They're way more expensive and require a prescription, but certainly acceptable, just a little bit more of a hassle to get a hold of. Hey Kayla, I see you just jumped on. Are you up at Snow Basin today? How's the skiing? If so, I'm stuck down here because I'm on call. And then Cheyenne, if that's not working, then you move on to other things that are prescription. So check out the video. It goes through it in more detail, but that's where I'd start, some vitamin B6 and Unisom. Let's see. May on YouTube jumped on and said, hey, recently struggling with anxiety. Should I wait till it gets controlled before you try to conceive? I mean, it's not a bad idea. It just sort of depends on how bad it is, honestly. There's plenty of evidence for relative safety of a lot of antidepressants in pregnancy. And there's a video on my channel that you're watching this on right now called Safety of SSRI in Pregnancy or something like that. I go through the old data on Paxil and talk about some of the newer meds. But in general, if your symptoms are bad enough to be treated, then we absolutely treat them. And I wouldn't, especially if you're just sticking to like a Paxil or Prozac or one of those, wouldn't really worry too much about getting pregnant on that. So not that you necessarily need to have had that problem completely resolved, but at least maybe start getting on some treatment if that's what's necessary. So maybe just talking to your doctor about that in a little more detail. But it's not one of those don't do it kind of deals. Kayla says, skiing's been good. I bet it has. Gosh, it just never fails. If I'm on call, it's going to snow 2 feet. So I bet it's a zoo up there, especially being Martin Luther King Day weekend. Shaylee, one more question. What can you do to help with acid? So yeah, acid reflux in pregnancy, super common problem. I get that question like every day, so you're definitely not alone. It's a normal part of pregnancy. I would recommend starting with, it's just some simple stuff like over-the-counter Zantac or Pepcid. I would use the generic version of that, whichever one's the cheapest at your local grocery store. And they're safe. You could use them every day. If you use that and it's not doing the job, then maybe moving on to like a Prilosec or a Prevacid, which are still over the counter. They just cost more. They're newer medications. And so those are ones to think about for starters. It's, a lot of different reasons why, but the gist of it is you have this rapidly enlarging pelvic and abdominal mass pushing on your belly, pushing all the stomach contents up. And then the little muscle between the stomach and the esophagus tends to not work as well when you're pregnant. That's called the lower esophageal sphincter. And so the valve between the stomach and the esophagus is loose, and then you're making more acid because you're pregnant, and then you got this mass and they're pushing on your stomach. So it's kind of a setup. So that's the why, basically. And the things I'd try, again, just over-the-counter, Pepcid, Prilosec, any of those are fine. I just get the cheapest one. All right, Island Girl, hey, welcome back. She's chiming in all the way from Italy. It's pretty crazy. If you have any questions, let me know, guys. I think I missed one up here from Londi. Let's see. On pelvic rest is for low placenta. Let me just roll back here. Coughing, blowing your nose, making your stomach muscles hurt. Is this going to make the situation worse? No, it's nothing to worry about there. Particularly if there's no concern like with your cervical length. Just a low placenta in and of itself is not a risk factor for preterm birth in and of itself. So coughing and sneezing, although miserable, shouldn't increase the risk of anything bad. So good luck with that. And then as far as like what can you take, and that's the next question. Good question, Ashley. What can you take for a cold when you're pregnant? Pretty much any of the over-the-counter cold meds are fine. If you're in the first trimester, you should probably avoid using Sudafed. because it's a vasoconstrictor, and there's some sort of theoretical concerns that it might increase the risk of abdominal wall defects like gastroschisis. So, but outside the first trimester, even Sudafed's fine as long as you don't have high blood pressure. So otherwise, then any of the other stuff, so Robitussin's fine for cough, Mucinex is fine. Any of the Tylenol-based cold products are generally fine. So any of the typical over-the-counter stuff that you can get is usually safe. Let's see. Amber, left slide sleeping the best. Is it just your back or what? Is that? So yeah, the big question is like sleep positions in pregnancy, what's best? And there's a video on my YouTube channel that talks about that in a little bit more detail, but basically what you don't want to be is a back sleeper. You don't want to sleep on your back. There's evidence that you have a higher risk of stillbirths if you are a back sleeper. So that means somebody who likes to fall asleep on their back. That means that you tend to spend the most time in that position. So whatever position you fall asleep in is the position you tend to stay in the longest. So if you're a side sleeper, you're more prone to sleep on your side through the night, and back sleeper is more on your back. And for reasons that have to do with the blood flow to the uterus and coming back from your lower extremities, if you're flat on your back, you tend to have less return to your heart and therefore less cardiac output, lower blood pressure, lower placental perfusion. That's thought to be why there's a higher risk of stillbirth. So it doesn't really matter left versus right. It's just don't be on your back. And if you wake up on your back, roll over. And there, part of the study I'm quoting you said that basically the more times you woke up at night on your back and rolled over, the lower the risk of stillbirth. So probably your baby's like, hey, wake up, roll over. So it's really the back sleepers that we worry the most about. And then if you are a back sleeper and you're having a hard time, my advice is just put a pillow under one hip so you have a little tilt. And that tilt is enough to get that uterus off your vena cava, and in general is enough that should mitigate the risk. All right. Janica is, if there is an expected ectopic, and you saw free fluid during vaginal ultrasound, we thought, well, if it's an ectopic, then the free fluid is probably blood, if that's the question you're asking. If you have a known intrauterine pregnancy, it's not anything to worry about. It could be just a little fluid, could be a little bit of blood, but the big question is like, if you are thought to have an ectopic, then that's probably blood. That's a big deal, and that's just one of those things that needs to be followed up on right away. So if you're being followed, great. If you're not, then you should be. That's what it sounds like. Let's see, Jenny. At what point is it best to make sure you're sleeping on your side the most? Really, probably after about 20 weeks. Prior to 20 weeks, the uterus is just not big enough to make a difference. But certainly after that, and definitely like third trimester and beyond. So it's good to start working on from about 20 weeks. Before that, I wouldn't worry about it really at all. All right, good questions. I think I've caught up. If you did not get an answer to your questions because I didn't see it, so let me see. Okay, over here on YouTube, sorry, Island Girl says, I took my first cycle of Clomid last month, but since you got a yeast infection, decided to stop and skip and get it treated, then continue Clomid next month. Is that okay? Yeah, that's fine. So it's okay to, I mean, there's really no definitive evidence on any yeast meds causing any significant problems in pregnancy, with the exception possibly of diflucan the first trimester. But even that, the data is not great. So I definitely wouldn't worry if someone got pregnant and had happened to have taken a diflucan. I wouldn't give it to a first trimester pregnancy person on purpose, but I wouldn't freak out if they had it. In general, I don't think it needs to hold you up at all. So I just keep pressing on, and good luck next month. Megan, what are the symptoms and treatments for high testosterone in female? So the symptoms of high testosterone generally are going to be things like increased acne and facial hair and abdominal hair. Those are the most common. And you see those a lot in patients who have PCOS, and you can see them sort of at sudden onset, sudden worsening of those symptoms that were not there in the past. Makes you worry a little bit about a rare ovarian tumor that could be producing testosterone. I think I've seen that exactly 0 times in my life, so it's not very common, obviously. And it would really only be something to think about if like never had this problem and then all of a sudden it was really severe. You're like, okay, well, let me check some labs. There is another category of an adrenal um, problem called 17-hydroxyprogesterone, um, 17-hydroxylase deficiency. I think I'm getting that right. And it leads to an increased production of some um, testosterone-like hormones, and that's one of those that you're actually born with, and so probably a chronic condition, and probably not just an all of a sudden pops up out of nowhere. Um, so if we're not talking about those kind of sudden, dramatic, and not very common things, just sort of generally speaking, some increased acne and facial hair that's kind of gradually developed over time, then you think, well, this could be a PCOS type deal. Um, Birth control pills are certainly very helpful. They're thought to reduce the unbound free testosterone, and if that's the case, then that should help with those symptoms. If if you've tried that and it's not working, there's spironolactone, which is basically like an anti-androgen, and those medications are things that can help. Megan, you said yours is sudden, so getting some labs to see what's going on there, probably a good idea. Um, let's see, Janica said, do we have a patient advocate team or person? Not necessarily, but I mean, if there's concerns, you can always either direct them just to your doctor or to the office manager, and you can call and ask to speak to her. Um, so I don't know if there's more to that question that you need me to answer, but that's the general gist of it. There's not a specific person, but really we'd like to think everyone here is an advocate for our patients. So hope that helps. Okay, so let's see, Kira, is heavyweight lifting and CrossFit dangerous in early pregnancy? No, it's really not. I have a ton of patients who do CrossFit or other physical weight type activities. And generally speaking, my experience has been they do very well with their pregnancies. They tend to gain just sort of a healthier amount of weight. And there's evidence of that in other studies as well. Just people who are more physically active tend to have a healthy weight gain, not an excessive amount of weight gain. There's evidence that that would reduce your risk of C-section. So I think there's mostly just benefits to physical activity. There probably are some types of activities that you should avoid, but lifting weights in and of itself is not one. But when you're certainly third trimester, you probably don't want to be flat on your back exercising. It's like doing bench presses and stuff like that. And I usually recommend avoiding like big squats, 500-pound squats or 300-pound squats. I just, you kind of worry about, well, you're going to throw your back out or do something weird to your pelvic floor. But lighter weights are fine. And I've had plenty of patients who've done CrossFit or things like that the whole pregnancy and really not seeing any problems at all. So I think by and large, it's a good thing. And I encourage folks to stay active. Let's see. Abigail says, thinks she might have cholestasis. Should she go to labor and delivery or wait till we open on Monday? Either way, it's a lab that takes a couple days to get results on. You're more than welcome to go to labor and delivery. They can do the labs. The hospital seems to turn them around a little faster than LabCorp, which is what our lab uses. It's not a suddenly life-threatening kind of thing, but more of a chronic thing that's managed throughout the pregnancy. But either way is fine. If you feel like you want to, you can go in. The trick is it's more expensive to go through labor and delivery typically for most people's insurance. So I think it's probably okay to wait till Monday, but not wrong to go in if you want to. Let's see, Birkenbag. Hello from the UK. Hey there. If you have any questions, let me know. You can put them in the chat. Happy to answer them. Let's see. I think I'm all caught up here. Yeah, Kara, no 500-pound squats for me either. Don't worry. Okay. Well, I think we're caught up. I'm just going to check here on the stream, make sure everything looks like it's working good. So if there's other questions, stick them in the chat. Oh, Abigail, so itchy. Ugh, yeah, it's really annoying. The big one I said before, and I don't know if you heard it or not, but it's really all about hands and feet. So the palms of your hands, the soles of your feet. Those are the ones that are most common with cholestasis. Trying to get that stupid light out of the way, but I can't. So if it's just generalized itching, it's less likely to be cholestasis. But if it's like the palms and your soles, then that's the one that in my experience has been the most specific. Let's see. Does breastfeeding increase or decrease postpartum depression risk? I would, the short answer is I don't know the answer off the top of my head, but I would suspect that postpartum, if anything, postpartum depression might be reduced by breastfeeding. I'd have to look into it a little bit to really. Let's see, Jenny, how much water should you be drinking while you're pregnant? A lot. um, probably somewhere in the neighborhood of 100 ounces a day. I've heard some people going like a gallon a day. One answer that I tell everybody is one easy way to do it is just look at your urinary output and the color of your urine. So when you're getting dehydrated, your urine tends to get darker, and of course you tend to make less. So if you're drinking enough that just all day long you're peeing nice, clear urine and lots of it, then you're probably doing it right. And if it's the opposite, not peeing very often, and when you do, it's not very much, and it's real dark, that's your kidneys saying you need to drink more. And your kidneys are really pretty smart, and for the most part, know what's up. So if your kidneys are telling you your urine's all dark and gross, you need to drink more, you should drink more. But just a good round number. I mean, 100 ounces a day is a lot, and it's probably hard to do. But, I don't know how big this thing is, this giant bottle, but this is like number 4 or 5 for me today, whatever that's probably 30 ounces. So I think I'm probably up over 100 already. So I think it's doable. You do have to keep something with you. It's hard to drink enough water if you don't have a decent water bottle. So keep that in mind. And, without going super deep into the research and the basic science, staying away from plastics when you're pregnant and probably just not pregnant is pretty good advice. So primarily we know about bisphenol A, which is BPA. It's thought to be a hormonal mediator. There's a better word for it that's escaping my brain right now. It's amazing how hard it is to think when you're on live TV. They're a hormonal interrupter, that's what they call it. And basically BPA, which is what's in plastic, is one of these hormonal interrupters. And there's all kinds of bad effects in pregnancy especially, but even in non-pregnant people. And there's all kinds of research linking it to all kinds of bad things, including obesity. And the list is probably huge, and it's probably a good video topic that I'm going to write myself a note that maybe that might be a good topic to talk about. So not drinking out of a plastic container all day and not eating your food out of plastic containers all day is probably a good idea. Sticking to things like glass and stainless steel, probably safer. And this water bottle is BPA free, but who knows what other plastic crap's in it that's bad for you. So long-winded way of saying how much water should you drink? A lot. Have a water bottle. All right, good questions. Let's see. Birkenbag said, history of depression, worried about it in the future. Any tips? Yeah. So tips to reduce postpartum depression. There's a bunch of different things you can do, a lot of which are just simple, non-medical, non-medication related. And a big one is, it's the winter time right now. It's all dark and dreary outside. That doesn't help. So getting sun exposure when the sun's shining, there's evidence. Some people who have sort of a seasonal depression, that really helps. If you live in a place where it's dark and gloomy all the time, then getting a light that exposes you to the right type of UV light waves can help. Pretty sure you can get those on Amazon. So I think that's helpful. Sun exposure, outdoor sun exposure is good, or the lights like I talked about. Physical activity, aerobic activity, there's some evidence in PMS that it helps. There's probably evidence in the depression literature as well. I always joke with people that triathlon is like my Prozac, but I think it's real. I've had such better mood in the last 10 years when I've exercised regularly than before when I didn't. So to me, it's my Prozac. So I recommend that for sure. And then, of course, medications are perfectly appropriate. And we use them at times in people who have a history of postpartum depression and are now pregnant. Maybe you start it up like right after you have the baby, or even immediately postpartum, or even before you have the baby. So any of these are appropriate. Maybe just talk to your doctor more about it for going forward. So let's see. Tina, just curious about causes of miscarriage, why they happen, 8 weeks pregnant right now, and this concept of a miscarriage is, yeah, it's kind of scary. Well, I mean, the whole idea of like the medical term is missed abortion, is like it's a miscarriage that hasn't been clinically recognized yet. So there's no bleeding, there's no cramping, there's no outward signs that anything's wrong, but in fact, something's wrong. And really, the causes of that type of pregnancy loss are no different than any other type of miscarriage. So a significant chunk, up to 2/3, are chromosomally abnormal, and those are generally random events. They are typically not anything that's repetitive. Once you've ruled out chromosomal abnormalities, then there are some uterine factors. So if you have a uterine septum, for example, if you have a uterine fibroid in the cavity of the uterus, that could be a cause. There are some autoimmune type things called antiphospholipid antibody syndrome. And these are really things we're talking about for recurrent miscarriage. There's a video on my YouTube channel that talks about that in more detail. So if you're curious, you can check it out. I think it's called like Evaluation of Recurrent Miscarriage. Let's see. Jennifer said, got her Tdap on Thursday, and today's site's red. Feels like there's not. Yeah, so injection site reactions are really common. Tdap specifically can be really sore. And I know the last Tdap, yeah, and now it's better. Normal, yes, it's normal. So flu-like symptoms after the flu vaccine are probably one of the most common side effects, if you want to call it that, after a flu vaccine. It's nothing to worry about. You can't get the flu from a flu shot. You can get some flu-like symptoms, and it's annoying for a day or two, kind of like you described. You feel crummy, and then it goes away. I've personally always thought that probably means you had a good immune response because you had some symptoms that are basically immune mediated. So if you're having those type of symptoms, probably it's a good sign that it worked. So let's see. Kaylin, how do you stop your milk supply? How long does it take if you choose not to continue breastfeeding? Yeah, so breastfeeding is kind of one of those supply and demand type systems. So the more breast stimulation there is, the more milk supply there's going to be. And so if you wanted for your breast milk to dry up, then it's kind of the opposite. So the least amount of breast stimulation possible. And so I tell people like wear like a really tight fitting bra all the time. Don't stand in the shower and let the hot water hit you in the chest. No breast stimulation. And that kind of more than anything sort of simulates the fact that you've weaned and there's not any breast stimulation anymore. And that should reduce breast milk production. Let's see. This is a really good question. Tiffany, can you continue ketogenic diet while pregnant? Short answer, no. Stop right away. There's a video on my YouTube channel that talks about this in some detail, but there is a study out there that shows higher risk of spina bifida in moms who were on the keto diet. And there's a couple different reasons why that might be. One of which is if you've eliminated grains from your diet, in the U.S. at least, all of our breads are fortified with folate. And so if you're not getting any kind of bread, then you're not getting any folate in your diet, potentially, unless you're eating a lot of green leafies to make up for that. So, or taking a lot of supplemental folate. That's one reason. Another reason may be something to do with the actual ketotic state that you develop when you're on a keto diet. So, when you're doing the test and you're drawing your blood and you're testing for ketones, it may be that the ketones are what we call teratogenic. They may, in and of themselves, increase the risk of birth defects. And so that's why I think you shouldn't be ketotic when you're pregnant. We actually test for ketones in the urine when we see patients. And if you see ketones, we're like, okay, you need to eat more because you're showing some signs of starvation. That's what the keto diet does. Burning fat, which if you're not pregnant, that's great. But when you're pregnant, we don't want that. So short answer, no. Definitely don't go ketotic when you're pregnant. I would personally be off that diet and taking a folic acid supplement, even higher than average maybe because of that history, preferably for a couple months even before you try to get pregnant, just to play it safe. So hopefully that's helpful, and check out the video on my YouTube channel. It talks about it in a little more detail. Let's see. Let's see, is egg freezing for social reasons worth it? Single and 28. It's a good question, and actually, it's another one of those videos I've been thinking about doing. it's become more popular. Let's say it's become a thing that you read more about and online and magazines or whatever. Um, it works. It's expensive, um, and you have to balance that against how much money do you want to spend on something like that. Um, so the short answer is yes. It works. It's fine. It's expensive. I guess that's the answer. Um, Probably best done by somebody who's not much older than you. You said 28, so kind of like 30s, early 30s. If you haven't had kids yet, but you want to reserve the right for down the road, then see you, Dee Dee. Take care. Um, then egg freezing maybe is worth it. And a lot of people have delayed childbearing because they have a career and they've focused on that. And then they get a little older and they're planning on starting a family later. Then it's potentially an option. I mean, like I said, it works. It's just in the U.S. at least, it's $10 or some $1,000. So it's a lot of money. I don't know what it's like in the UK. Tell me if you know. I'm just curious. Habiba, hey, how are you doing? If you got any questions, shoot me a chat there. Let's see. Cassidy, almost 4 months postpartum. Sex is still painful. Said you're all healed up. Could there be a tear? Well, one question is if you're nursing. So if you're nursing, you tend to not make very much estrogen because you're not ovulating, which is, again, why you don't have your periods when you're nursing. And for some people, that's enough to cause the vaginal tissue to start to thin and cause painful intercourse. So it's fairly common. Usually can be resolved with some vaginal estrogen. So we do prescribe that fairly commonly in the office for folks after you've done an exam and made sure everything's okay. So maybe getting checked out and see how things look. And then if everything's looking normal and it's still painful, then maybe considering a little vaginal estrogen might help if you're nursing. If you're not nursing, then I'd say just get an exam, kind of see what's going on and go from there. Painful intercourse is a tricky subject with a lot of avenues that you can go down. Let's see. Lisa, I think that says. Question: how do you remove scar tissue from fallopian tubes? And if you do, can it get blocked back? It can. It's tricky. It's not easy, and often not successful. But and there's different types of scarring of the tubes, so there's different potential answers. But let's just talk about the easiest one to think about, and that's if the very tip of the fallopian tubes are obstructed. So we call that a distal obstruction. You can see those when you shoot contrast dye up in the uterus from hysterosalpingogram, and you can see it get into the uterus and then out to the tip of the tubes but not come out. Sometimes there's a little scarring there at the tips. Those are sometimes kind of easy to just open up surgically, but you're right, there definitely is a risk that it could scar back closed. The other one is a proximal obstruction, so right where the tube inserts into the uterus. Sometimes those are treatable with a hysteroscopic procedure or an x-ray procedure where you feed a guide wire up into the tubal opening from the inside of the uterus. And if you have a little balloon catheter on the end of that, you can dilate that, and that'll sometimes unblock a proximal obstruction. So those are the two most common. The proximal ones probably have a little better success rate. I don't have any data to quote. That's just kind of off the top of my head. Than distal tubal obstructions. They tend to be from either things like endometriosis or prior pelvic infection. So there may be more than one thing going on there that's making it hard to get pregnant. Obviously, in vitro is the ultimate solution for tubal disease. You can not even have tubes and still get pregnant if you do in vitro. So, if nothing else, that's something to consider. And a lot depends on your health insurance and which country you live in and what the treatment options are and things like that. But surgery is a possibility. Let's see. Tina, are non-invasive tests accurate, reliable? It's not covered by health insurance in Canada. Yeah, so it sort of depends on the test you're talking about. So let's talk about a couple. The first one is the newest one, and at this moment I'd say the most commonly utilized in the U.S. is a cell-free DNA-based test. And there's a bunch of different name brands, but they're all using the same concept, which is isolation of fetal DNA from maternal bloodstream. And that test is up there in the 99.9 whatever percent accuracy for 4 things, and only for 4 things. So it tests for Down syndrome, trisomy 13, trisomy 18, and sex chromosome abnormalities, and that's really pretty much it. Some of them can also test for certain microdeletions, but not all microdeletions. There's usually a handful they can test for. So it definitely doesn't test everything, but it hits some of the most common abnormalities. Really, the only way to get the broadest answer is to do either CVS, which is a placental biopsy, chorionic villus sampling, or amniocentesis. Those are more thorough. But for screening, most people are not going to do that because it's invasive. Like you said, you're looking at non-invasive. So the cell-free DNA is the one that's most commonly used in the U.S. at this point. Prior to that, we were doing the nuchal translucency, which is where you measure the back of the neck on the baby. And then they do a couple of blood tests. It's a pregnancy-associated protein A, so that's PAP-A, and inhibin levels. And those are that test is actually ultimately performs fairly similarly to the DNA test, within probably a 10th or 100th of a percentage point. So that one's also good, maybe less expensive. I don't know about in Canada, but you might look at that as well. So that's called a first trimester screen, or you could look at it as a nuchal translucency, and it's also got some blood work that goes with it. And there's a video on my YouTube channel that talks about it a little bit. I think the name of that one is 35 Too Old to Get Pregnant, which of course it's not. But that was just the title of the video. So maybe check that out. I think there's some pictures in there that go through some of those testing. Let's see. So Tiffany, how much folate should you supplement? Do you need more than a prenatal? I think maybe that's going back to the keto question. Yeah. At least 1 milligram a day. And, you really can't OD on folic acid. So even like 4 milligrams a day is fine. We give that to people who are taking certain anti-seizure medications, and we give that to people who have a history of a child affected with a neural tube defect. So 4 milligrams a day we know is safe, and wouldn't hurt anything. So I'd say anywhere from 1 to 4 milligrams a day is totally fine and not going to hurt a thing, and can only help. So I think the big thing is just not to be on the keto diet when you're getting pregnant. Let's see, Jenny, what point are you comfortable checking for gender? Generally 14, 15 weeks is, depending on the patient and the baby and your ultrasound equipment, pretty doable. And then, do I suggest a blood test check early on? No, I don't suggest it. Just to check the gender. It's out there. It's available. You can certainly do it. That's the test I was just talking about, that cell-free DNA test. It does tell you the gender because it's looking at the sex chromosomes. But I wouldn't recommend doing it just for that. It's an expensive test, and it's really intended to screen for other things. But you do get that piece of information. So if you were thinking about doing early testing for chromosomal abnormalities and you want to know the gender, that's maybe a good way to go. Let's see. Kara, can you get an STD from a non-sterile pap smear tool? Probably not. I mean, it seems very unlikely. And I don't know by define non-sterile, because when you process the say the metal speculums in a doctor's office, they're all first washed with the bactericidal solution and then autoclaved, which means they're exposed to very high heat and pressure. So they come out of that sterile. Now, most places don't put their speculums into sterile containers after that, but they've been sterilized and they're clean. So as long as it's not being reused without being reprocessed, I think that no, the answer is no, you can't. Now, if you had I can't imagine how this could possibly happen, but if you had a used speculum that got reused without being processed, yeah, that would do it possibly. But in any other circumstance, I just can't imagine that's going to be a problem. Let's see. Tina said ultrasound scan and blood tests are covered free. Okay, well that's Tina, if you wanted a first trimester screen and it's covered, that's the one I would do, because really it performs about as good as the cell-free DNA. It's not as fancy or as sexy. It doesn't tell you the gender, which is kind of the selling point that a lot of the companies in the U.S. have used to promote the use of the cell-free DNA test. It performs slightly better than the NT scan with blood work, but not enough to make it like go pay for it. And I don't know what the cost is in Canada, but in the U.S. depends on the company. Could be anywhere from a couple $100 to a couple $1,000 depending. So yeah, I'd go for the NT scan personally. That's performs pretty well, and if it's covered, go for it. And in some parts of the U.S., that had become sort of standard screening for Down syndrome. But then the DNA thing came out and kind of flooded the market here. Okay, so good questions, everybody. Thanks. Been going now for just about an hour. Holy cow! If you have other questions, we'll give it maybe another couple minutes here, and then if nothing else pops up, maybe we'll call it a day. Thanks to everybody who's watched and has been watching the whole time. Let's $500-600 in Canadian dollars. Yeah, that's a lot of money. So I'd go for the free one. But if you have questions, pop them up there. We'll watch this maybe for a couple more minutes. See if anybody else has another question. Speaking of drinking water, I'm drinking my water. Let's see. Here's a good question. Basically, it's when to start pap smears. And the specific question was, do you need a pap smear if you've never been sexually, or you said virgin, so never been sexually active. So the guidelines in the U.S. are to start pap testing at age 21, and they don't really say whether or not you've been sexually active. We all know, however, that the only way to acquire cervical cancer or dysplasia, which is a precancerous change, is from HPV, and HPV, human papillomavirus, is transmitted sexually. Now, it can really mean any type of genital contact, so not to be graphic, but it wouldn't just have to be intercourse that could do that. So when you say virgin, it's kind of like, well, define virgin. But, if there's been no contact whatsoever, then the risk is basically zero. And I've certainly had patients who were in that situation who were anxious about having a pap, and we didn't do it after we talked about it because we know the risk is low. And after I explained to the patient the situation, they choose to not have a pap smear. I think in that situation, it's very reasonable. But otherwise, in the U.S., the recommendation is to start PAPs at 21. And then in the U.S., we're screening now people in their 20s every 3 years. And then in your 30s, we're doing HPV testing. And if it's normal, you're good for 5 years. Let's see, Jenny, how many babies have I delivered? The last time I kind of did the mental math was about 10,000. So a couple. Let's see. Kevy, hey, is it normal to have pain or crampy feelings when you're ovulating? Yep, it is. In German, the term is Mittelschmerz. It means middle pain. So mid-cycle pain. It's very common. Let's see. Lisa. Am I saying that right? Can you do tubal canalizations to remove scars from your fallopian tubes? It can be done. I don't do it personally. Probably in the U.S., and I'm not sure where you're chiming in from, they're done typically under fluoroscopic guidance. So you use an X-ray, and then you get that guide wire up into the tube, and then you dilate it up. In UK, tested 25. Yeah, very similar to the U.S. Let's see. Can you take a gummy prenatal while taking iron, trying to conceive, or is it too much? No, because typically there's not iron in a gummy prenatal. I think it's pretty hard to get iron into a gel type formation like a gummy. So they're usually tablets. So if you're taking a gummy and you're taking some iron, that's fine. Shouldn't be a problem. Let's see. I think I've answered all my questions. Just looking back through the list. I think I'm good. All right, we'll give us another minute or two, guys. Thanks to everybody who's been watching. Let me know on Facebook if you're still on here. Hey, good night, Island Girl. Good night in Italy. That's awesome. Jamie, yeah, thanks. Thanks for saying hi. If you're watching on Facebook, let me know how it looks. Earlier people said sounded and looked okay. I've changed up the stream today just to see. I'm trying to get a little better streams. So let me know. Let's see. Tina, why'd I chose this instead of something else? It's a good question. The long story is, well, I'll try to make it the short story. In the U.S., particularly when I was going through medical school, we did rotations, and so the first 2 years were just in lectures, in anatomy lab and things like that. So you never even really saw a patient. And then the second 2 years were doing your rotations. So you did everything. So surgery, medicine, psychiatry, OB, everything. And you just kind of went from rotation to rotation. And to me, it was just sort of what I liked. And there were things I liked about other specialties, but OB just kind of seemed to have the best of all the different fields, I guess you could say. I liked surgery. I thought I wanted to be a surgeon. And then when I started hanging out with surgeons and saw a lot of them were pretty unhappy, miserable people, I didn't want to be one of those. But I liked surgery. And OB, of course, we do some surgery with C-sections and GYN surgery, so I had that. I liked more the relationships you get with people in OB. Most people that you wind up delivering your baby, you see them for almost a year, sometimes for years and years, before they're pregnant, while they're pregnant, afterwards. So you get a lot longer time to get to know people, as opposed to, say, general surgery where you've got a gallbladder. I met you yesterday. I took it out tomorrow. Never saw you again. So to me, I like that patient interaction and kind of the long-term relationships you can make with people. There's folks I delivered, 20 years ago that I still hear from, which is really cool. And from all over the world. I know people who, lived in the U.S. I delivered their babies. Now they live in Japan, and, I still hear from them. So it's pretty cool. I don't think most people who, had their gallbladder out still are in touch with their doctor who took it out 20 years ago. So that's probably why. Let's see. Kaylin, how long do you recommend waiting to have intercourse after giving birth? Different answers online. Yeah. The traditional OBGYN tried and true answer is 6 weeks. It's arbitrary. There's no evidence behind it. And it's not natural or based on any kind of science. So, but that's what everybody says. Now, there are some things. So, you got to heal. So if you had a tear, you got to heal from your tear. And if you haven't healed from your tear, it's not going to be a good thing. So at a minimum, you want to be totally healed up and not having any bleeding or anything. And then basically, if it feels okay, it's probably fine. Now, the only other thing to think about is birth control. So if we have people who want to get an IUD or something, it's difficult to put one in if you've already started having sex again. We got to wait for a period to come around or wait a certain period of time after intercourse to put the IUD in to not worry that you got pregnant in the meantime. So not having intercourse until you've got some birth control on board is probably a good suggestion. If you're nursing exclusively, then that's probably less of a concern, but hopefully that answered your question. Cool. All right. Well, thanks, Tina. Thanks for the kind words there. All right. I think we're good. I'm not sure what... Oh, here's one. If you tear during pregnancy, is it likely you'll tear again next delivery? Maybe, but not as bad. So you tend to get less of a tear. Sorry, I'm just making sure this is working. Is YouTube still working okay? I'm getting some kind of weird error message. Let me know if you can still see me on YouTube if it's working. It looks like it is. So yeah, if you tear during a delivery, you probably will tear less on a subsequent delivery, just because that's sort of when it heals. It doesn't go back 100% to the way it was before. And some people don't tear at all. Okay, YouTube is still working. Great, thanks. I got some kind of weird error message on my feed, and I wasn't sure what it meant. I tried turning up the bit rate so it would make it a prettier picture. So we'll see. It seems to be working okay. All right. I think that's it. I'm not seeing any more. Oh, here we go. What can you do to prevent tearing? That's a good question. The big thing, and it's the thing that I always say, is don't have an episiotomy. That's the number one thing you can do to limit the perineal damage. So to limit the amount of damage done, the best thing you can do is don't have an episiotomy. And the evidence is there to support that statement. The next thing you can do is, to the extent you can, you try to have a controlled delivery of the head and the body of the baby. Just not blowing it out all at once is probably more prone to tear than if things kind of come out easy and gently. It's not always practical. Supporting the perineum, there's some evidence that doing that with a warm compress could reduce tearing, and that's about it. There was one study that looked at delayed pushing versus just start pushing right away when you got complete. And if I remember correctly, then the delayed pushing, so in other words, like you got complete, you rested. I don't know why this would matter, but it seemed like there was a little higher rate of more severe lacerations, and I didn't understand that one from that study. Do quick deliveries make it more likely? Potentially, especially if it's your first, but if it's not your first, then probably less of an issue. So yeah, all good questions. Cool. Well, not seeing anything else. We'll wait another minute or two, see if anything else pops up. Otherwise, we'll probably call it good for today. As always, thanks everybody who's been watching. These are fun. I like doing these. And I've started doing these dual streams where I've got YouTube and Facebook going, so it gets more people on and more questions coming my way, so I'm not just standing around waiting on people to ask me a question. So thanks to everybody who's been watching. Thanks for all your questions, because I don't have anything to say if you don't ask me a question. Maybe we'll see you again next week. I do these every week or so. It sort of depends. Couldn't do it yesterday. It was too busy, too many babies. Today's been sort of busy, but slowed down for a minute, so I thought I'd jump on. And I made it the whole hour without getting a single phone call from the hospital, which is a miracle. So let's call it good there. Thanks to everybody who's been watching. Hope you guys have a great weekend. And if you're not on call and you live in Utah, hopefully you're skiing, because I think it's been a pretty good weekend. Make a couple laps for me. All right. See you guys. Take care.